I was preparing for NEET with the help of SPEED app. To some people, they have used SPEED app and they got a good rank in the past 2 or 3 years. So I was like, okay, the material would be good here. So then I started with the videos, divided my time into two slots, one for the revision of the notes I had made, second for the question answers and the MCQ grant tests that are there.
So I bring in all the wishes and greetings on behalf of all the faculty members and team of SPEED to Dr. Kritika Dwivedi for scoring a topmost rank of rank number 1 in DM Critical Care Medicine Group in NEET SS 2025 session. Congratulations to you, Doctor.
Thank you, sir.
So I thank you for sparing your time to share your valuable experiences with us and also to the students who are watching this video.
Yes, sir. Thank you, sir.
Great. Now, can we know a detailed history that where you started from till date, what all you have done, and to get on to what you wanted?
Sir, I have done my MBBS from Government Medical College, Srinagar, Vincent Singh Galwali Medical College, Uttarakhand. After that, I have completed my PG in MD Anesthesia from Government Medical College and Hospital, Chandigarh. After that, I was preparing for NEET with the help of SPEED app. That's all. Currently, I'm not working, sir.
Great accomplishment, wonderful achievement, and that you
Yes,
all
sir.
done
Thank you.
well. Why anesthesia was your passion?
Actually, I have seen that we are not that much exposed to anesthesia during our MBBS time. So when I started working in anesthesia, I realized it is a vast branch. You can have knowledge of ICU, you can have knowledge of like need to have knowledge of all the physiology. Either it's pediatrics, either it's uh, surgery. You need to know every single thing. And after working in that, I realized that it's a good branch. It's a great branch, and you get a really good exposure from the starting of your PG. You are working in OTs, you are working with highly specific branches, and you are working with like a lot of good people. So you get a great exposure from the starting of your first year to till the end of your third year. You are really good at all the basic surgeries. And in our college, we have a great exposure to critical care. So that's why I kind of leaned off toward critical care during my PG only.
Great, doctor. Great to know. And a super specialty of a critical care medicine, an idea started when and who inspired you, from where you got this, and how you working towards it?
Like I told you, I was leaned towards critical care during my PG time, and my HOD was my HOD and guide were like the people, they will tell you to do things like, okay, they were always accept your suggestion when you were working in ICU, and we see the result in ICU. I was kind of leaned off like it's a good place to work. And after that, when I completed my PG, I talked to my seniors, I talked to my HOD and guide, and they were like, okay, you can work for critical care. You can just give a try for critical care medicine if you want. And after that, I was like, okay, I like working in critical care. So let's give it a try.
Great, doctor. Very nice. And once you decided to do a critical care medicine as your super specialty, and
Yes.
how you started to prepare, what was your preparation strategy? How you achieved this topmost rank?
Sir, actually, I started with the Speed app only. I talked to some people. They were working, they have used Speed app and they got a good rank in the past 2 or 3 years. So I was like, okay, the material would be good here. So then I started with the videos, the Paul Marino's and the critical care or medicine videos that are available. I first started making the notes, and first month I just gave to the notes. I make the notes, I revise the notes, and that's all. After that, I divided my time into two slots. One for the revision of the notes I had made. Second for the question answers and the MCQ grant tests that are there. And a small time for the recent advances. You just keep adding and adding. So I used to give like 1 hour for that recent advances. Okay, there is another new video. I should just read that now. So that's how I prepared. Like I divided my time into two slots, mostly one for studying and one for the question answer.
Great. Very meticulous and
Yes.
focused with the
Yes, sir.
clarity of what to do.
Yes, sir.
And can we know number of questions you answered in this paper?
Sir, I have answered. I think I left only 5 questions, so 145 question I have answered.
Okay, great. Now, can we know about the paper? Can you share something on this paper? How it looked as a PG exit standard, which portion or how much of general anesthesia, how much of a super specialty standard, anything on that?
Sir, the paper was mostly from the critical care part only. There was like 15 to 10 question of anesthesia, and a lot of question were there from cancer oncology. and like some question were only like how you will manage a patient if a cancer patient come to a critical care scenario. So those questions were easy, but there were some theoretical questions like which kind of cardiomyopathy this is causing. So there I was like, okay, I have not read this part. So it was like easy for because of the material, I guess, like it was all touched upon from the material, and I have a little bit idea of what's like going on in this question. I can use a little of my brain so that I can like pick into if there was a doubt between two MCQ to answer. I was like, okay, I have to use my brain here, and I can go for this one answer. So it was like that only. So in some questions only, like most of them were all from critical care.
Great. And what will be your message for students who are preparing for critical care medicine?
I think first during your PG you should be have a basic foundation of what you are doing. During your ICU posting, try to read Paul Marino, try to read critical O medicine if you are interested in ICU and want to work in critical care medicine. And most of the learning is when you are going for rounds, when your teachers are explaining you something, that's when you are going to learn it more better. And you can just go down later and can see in the books, okay, that was I read today in the round. So I think the round teaching, and after that, if you are preparing, like I have prepared after my PG. If you are preparing during your PG, you need to be like match out. You have to work for anesthesia. You have to study anesthesia. Also, you have to study your critical care portion also.
Great. Now, time to thank, and whom all you want to thank that you feel that from day one till date they have stood by me, helped by me to achieve what I am today. You can use this
So
platform.
my first, I will thank my family for this. Like they have always provided me the support and encouragement to do whatever I want to do in my life. My father, my grandfather, my nanu is like a building block in my starting to my end, and my whole extended family. After that, my HOD of GMCH and my guide Manpreet sir and Dr. Pada sir, Dr. Richa ma'am. Like I have so many people to thank for this. Like they have just helped me to achieve this. Dr. Swati ma'am, like a lot of people.
Great. I mean, I congratulate you. You mentioned everybody. And
Yes, almost everybody. Yes, sir.
so we are very happy, and we're really blessed to have you as your student, and I mean to see you performing amazingly well in the country and standing number one in this field in this country. We wish you
Thank you, sir.
all the very
Yes.
best and all the success for DM critical care as a super specialist, and to touch upon and save upon many lives to come to you. Best wishes to you.
Thank you, sir.